My name is Dr. Michael Mehnert. I'm a physiatrist at Everpoint Health. My role is doing a lot of musculoskeletal and neuromuscular care, diagnosis, and some interventional pain management. So I think I've always wanted to go into medicine to help people. As cliche as that sounds, that's probably the truth. Physiatry has always been an interest of mine. I went to Rutgers in New Jersey as an undergraduate, and I stayed there for medical school in New Brunswick. And then after that, I did a residency at the Kessler Institute in West Orange. And then from there, I did some additional training in sports medicine and in interventional spine techniques that I utilize. I really enjoy mechanical things like muscles, bones, and nerves, and just figuring out how things work and what problems are there that we can try and address or fix. In my role as a physiatrist, a lot of the focus is on helping people maximize and recover their function. And that can take a lot of different forms of treating musculoskeletal problems. There is some overlap with pain management in terms of trying to alleviate pain, whether that's with physical therapy or injections. It's really trying to help people become as active and stay as active as they want to be. Patients typically come to see me with some kind of a musculoskeletal problem, and that can be anything from joint pain to back pain or sciatica. We also wind up seeing patients for a variety of neurologic symptoms like numbness or weakness. And some of our interactions are going to involve diagnosis, making sure we get the right testing, the right diagnosis. And in terms of treatment, it can be anything from therapy to changing activities or using a brace to sometimes injections that are done with image guidance or spine injections. At the first visit with me, I think a new patient could expect that we would really try and take a pretty thorough history, do a pretty thorough exam, and then really get the sense of not just what the symptoms are, but what the effect that it's having on kind of the day-to-day life of that patient is. And then after that, the goal is to develop a treatment plan, whether that needs any more diagnosis, and then just kind of go forward into working on a path to recovery. What I like most about working at Everpoint is the culture that we have here. You know, we're really lucky to have a team of expert physicians who all want to work together for our patients. And I really get the opportunity to kind of use my skill set as best I can to try and help a variety of problems that walk in the door. Outside of work, I enjoy a lot of outdoors activities, so hiking, camping, spending time in those places. I like to try and catch a rock concert when I can, and other than that, it's just a lot of time with family.